Welcome to the seventh episode of the Real Health Talk series. The topic which we have selected for today is how to handle the stress of the exams. Why we have selected this topic? Because stress during the exam is a frightening experience across the globe in all genders and almost all nations. And this leads to according to the very recent research studies, this leads to not only to the poor performance of the exams, but failures, divorces, even major roadside accidents. I am Dr. Mohammad Azeem Rao. I work as consultant psychiatrist and public health professional at a medical university. So today we'll be talking about some signs and symptoms which are hallmark of the stress during the exams. And then we will also be talking about some common mistakes which happen, which the students do. And then we'll be talking about, is stress always bad? And then at the end, we will also be talking about some solutions, how we can handle this stress. There are some physical symptoms and psychological symptoms during the exam stress, which you need to be very mindful about. Amongst some physical symptoms, you lose your appetite, you feel bloating all the time, you become very cranky, irritable, you are not able to focus on your studies, and then you are also not able to follow some of your routines during the exams, and therefore it is telling that you are under some stress during the exams. Stress is not always bad. You can see that performance is increasing here and your stress is increasing. You might see that this is a green area whereby your stress is increasing on this, and then performance is increasing in here, and this is the green area, your performance is increasing, and this is the steady level which it achieves, and the stress level is, your performance is here and your stress is here. You are entering in the yellow zone out of your green zone, and in here if you stay like the same, you keep working and working, you become fatigued, you become exhausted, and eventually your performance starts declining in here, and eventually you enter in the red zone where there is anxiety, panic and anger. And this is the area where you cannot help yourself. Your doctor will possibly be able to help you. So but if you do not want to enter in this red zone, you need to stay here, you need to do your regular exercise, you need to follow a few of the techniques which we'll be discussing later, so that your performance is also increasing and your stress is staying at the optimal level. So this is the stress curve. If you understand this is very helpful to adopt some of the strategies which are very helpful. A few mistakes which students start doing during or due to stress of the exams is, some of the friends or family suggest them to take some medication, which may include your alprazolam, lexotanil, diazepam, rivotril. These are some of the common names you keep hearing, and they start using this medication just to relieve their anxiety and stress, or possibly to help them sleep well. Whereas I think this is very common mistake, and they become addicted to this kind of medication. So you need to be very careful about these medication. Until and unless they are prescribed by your medical doctor, you should not be using them. The second is that they start smoking, or they increase smoking. They start using cannabis, alcohol, because of the peer pressures, or some of the friends are suggesting that you may need to take some of the energy drinks, like there are many available in the market. So this is also another common mistake which they do. Thirdly, they think that if they start studying 24 hours 7 during the exams, this will be very helpful. Whereas I think this is a very bad example you are going to set for your own self, because this is not going to help facilitating your study, or this will rather enhance your stress. If you lose your sleep, you lose your routines, it is also very bad for you. These are some of the common mistakes which they usually do. Following a few simple strategies can help you. Unfortunately, there is no short-term management like prescribing some medication or energy drinks. please avoid them. Secondly, the long-term management in your behavior is very important, that how you plan for your exam. An exam which needs like 6 months preparation, it is not possible that you will be preparing and then passing it with some flying colors within 2 months is simply not possible. Therefore, you need to adapt some good strategy and planning if you really want to handle your stress during the exams and also expecting some better results. Thirdly, the routines which we usually miss during the exams, I think it is a very bad idea. So therefore, you need to understand and follow your simple routines and simple strategies. Like if you pray 5 times or 3 times, whatever your plan is, please keep following that. Similarly, keep doing your regular exercise. 40 minutes a day is very actually helpful to improve your performance and focus during the exams. And then always try to keep a balance over a long period of time if you want to have a balance for your exams or for any stressful period of your life, like maintaining a balance between your physical, professional, emotional, and personal life. This will allow you to be a better person, a better human being, a better self-controlled person for your exams. And last but not the least is the practice. If you are mindful about this kind of routines, whether it is exam or it is no exam, it is very important. Practicing will actually make you better next time. So following these routines will be, I think, very helpful. Thank you for your patient listening.